Today we'll see regenerative endodontics definition. Regenerative endodontics can be defined as biologically based procedures designed to replace damaged tooth structures, including tendon and root structures, as well as cells of the pulp tendon complex. Terminology. The term regenerative endodontics was approved by American Association of Endodontics in 2007. Terms such as revascularization, revitalization, and regenerative endodontics can be used interchangeably and synonymously. The term regenerative endodontic procedures cites all procedures that are directed to obtain organized repair of damaged pulp tissue and include future treatment approaches yet to unfold in regenerative endodontics. Historic Historical backgrounds of regenerative endodontics. In 1961, NIGARD was by use of a revascularization procedure for regeneration of the pulp tendon complex in immature teeth with pulpal necrosis. 1966 ruled DC use of a double antibiotic paste. In 1993, Hoshino et al. Use of triple antibiotic paste. In 2001, IBIA evoked intracanal bleeding steps. In 2004, Banks and Chop case reports on immature mandibular premolars. So, these are some definitions. Regenerative endodontics are biologically based procedures designed to replace damaged structures, including dentin and root structures, as well as cells of the pulp dentin complex. It's given by Murray et al. Revascularization is defined by Anderson is the restoration of the vascularity to a tissue or organ. Repair is the restoration of tissue continuity without the loss of original architecture and function. Revitalization is described as an ingrowth of vital tissue that does not resemble the original lost tissue. So, is RET a regenerative or reparative process? So, regeneration is defined as a restoration of tissue architecture and biological function of damaged tissue by tissue similar to the original tissue. Repair is replacement of damaged tissue by tissue different from the original tissue and loss of biological function. In animal and human studies, the damaged pulp tissue in the canal space of immature teeth after RET is replaced by bone, cementum, and periodontal ligament-like tissues. Therefore, RET is a reparative and not a regenerative process histologically. So, what are the primary goals of regenerative endodontics? So, there are three goals. First is primary goal, secondary goal, and the tertiary goal. Primary goal is elimination of symptoms and evidence of bony healing, often observed 6 to 12 months after treatment. So, second goal is increased root wall thickness or increased root length, often occurs in 12 to 24 months after treatment. Tertiary goal is positive response to vitality testing. So, what are stages of root development? So, it is given by SWEX. So, this is the SWEX classification of root development. So, 1 by 4th of the root formation with Bunderbutt's apex is the stage 1. 1 by half of the root formation with Bunderbutt's apex is stage 2. 3 by 4th of root formation with Bunderbutt's apex is stage 3. Full development with open apex is the stage 4. And full development with partially closed apex is stage 5. And full development with a closed apex is stage 6. So, based on SPEC's classification of root development, it is recommended that immature permanent teeth with necrotic pulp at stage 1 less than half of the root formation with open apex. Stage 2, that is a half root formation with open apex, and stage 3, two-thirds of root development with open apex. are suitable of regenerative endodontic therapy because of the short root, thin canal walls, and wide open apex, as apexification has no potential for root maturation. So, in mature permanent teeth at stage 4, nearly completed root formation with open apex can be managed with either regenerative endodontic therapy or an apical MTA plug and root canal filling because the canal walls have enough thickness and strength. Immature permanent teeth with a necrotic pulp requiring pause for adequate coronal restoration are not suitable for regenerative endodontic therapy and better treated with apical MTA plug and root canal filling.